Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. A lot of our female patients are confused about how soon after conception or after their last period can they actually do a pregnancy test. There seems to be a lot of confusion about this. Women are totally confused. Some of them think that they have to wait for a very long time before they can get a pregnancy test done. Some of them feel that they can do it even within 5 to 7 days, of their last period. I've created this video to clarify all these doubts and to tell you exactly how many days after your period or after intercourse or after your ovulation can you actually do a pregnancy test and get a reliable result. So to get to the point, you can do a pregnancy blood test around 28 to 31 days after your last period to get a reasonably reliable result. This assumes that your normal periods are at least 30 days. Your normal cycle duration is around 30 days. If that is the case, you should do your pregnancy test at least one day after the day on which you miss your period. That's relative to the last menstrual period, and the last menstrual period is the first day of full bleeding of your previous menstrual period. So let's say that you had your first day of full bleeding for your previous menstrual cycle on the 1st of January. You can do a pregnancy test preferably on the 1st or the 2nd of February, because that's when you'll be expecting your next period and you haven't had that period, and that is why that's when you can do the test. Now the next thing is, how many days after intercourse can you test? Now I've created a separate video on this for you to be able to understand, but assuming that intercourse has taken place around anywhere up to 5 to 7 days before your ovulation, which is the midpoint of your cycle, you can do the pregnancy test around 8 to 10 days after ovulation. I'll go into more detail about this in another video, but that's what you need to know. From the midpoint of your cycle, you need to count 8 to 10 days, provided that you had your intercourse before the midpoint of the cycle. And the last thing is, what does this pregnancy test actually tell us? Because if you're thinking about when you can do a pregnancy test, you should know what the pregnancy test tells you. So the pregnancy test basically measures the level of a hormone in your blood or in your urine, which is called the beta HCG hormone, which is only seen usually in women who are pregnant. To be able to understand better about when and how you can do your earliest possible pregnancy test, you need to know what are the different things that happen during your cycle, so that it becomes very easy to understand this. The first thing you need to know, and the first thing that actually happens, is let's begin from your last menstrual period. So this is the first day of full bleeding that you have. Now that is the day on which the next cycle actually starts. Now after that, you have something called ovulation, in which the egg is released. For most women, if your cycle is around 28 to 30 days long, this will happen somewhere on the 12th to the 14th day. This is called egg release. Now what you need to understand is that for you to get pregnant, the egg has to first be released, and it has to meet with the sperm within 24 to 48 hours of being released, because the egg can only be viable, or it can only live for around 24 to 48 hours after it is released. So once your egg has been released at the time of ovulation, you have around 2 to 3 days after that, during which the egg and the sperm can meet, assuming that intercourse has already taken place. Now once the meeting of the egg and the sperm is called conception or fertilization, and this usually happens around about anywhere between the time of the egg release up to maybe 2 to 3 days after that. Now after this, we have the process which is called implantation. So the fused egg and the sperm, this is called the embryo, and this embryo then moves through the fallopian tubes down into your uterus and implants into the uterus. So this passage of the egg from the fallopian tubes, the embryo from the fallopian tubes down into your uterus, takes around 5 to 6 days, or sometimes even longer. It could even take up to 8 to 10 days. Now once that happens, then and only then can the beta HCG hormone be actually released. And this is because when the embryo implants, or when it joins the uterus, it joins the uterus through something called the placenta, which is the connection between the embryo and the uterus, the mother's uterus. And it is this placenta that actually releases the beta HCG, and it is this beta HCG that we actually test for in the pregnancy tests. So I've given you the entire list, the entire chronology and the timings of all these things, and you can understand what is the earliest possible date of detection It's important to note that urine pregnancy tests take longer to detect because their threshold for detection is higher. So the beta HCG levels have to rise sufficiently before urine pregnancy tests can detect them. So how soon can these tests actually detect the pregnancy? I'm talking about the time after conception, that is the time after the sperm meets the egg. So blood tests can measure detectable levels of beta HCG around 7 to 10 days after conception. Whereas urine tests take a little longer, they are usually going to be able to detect around 10 to 14 days after conception. Because their threshold for detection is lower, blood tests are more likely to detect earlier, urine tests more likely to detect later on. So people tend to test too early. Many people decide to test for pregnancy sometimes even 5 to 7 days after intercourse without understanding what is the time of ovulation, what was the date of the last period, when did they have intercourse. All these things need to be factored in to predict accurately when you should actually be testing. So if you test too early, the beta HCG levels may not be sufficiently high to be able to detect the pregnancy, and so you get a false negative test, especially with home test kits. Secondly, if you test before the embryo has joined the uterus, it's not going to be able to detect anything because the beta HCG cannot be produced until that happens. So you need to remember these things. You need to remember the time chart that I gave you. And as a rule of thumb, the best time to test is usually on the first day of your missed period or a day or two after your missed periods, because that's when there is a high likelihood of the blood test actually detecting the pregnancy. And no matter what happens on the first test, make sure that you test again at least 2 to 3 days after the first test, because that will definitely be able to compare the two results and come to a better understanding of whether you're pregnant or not.